Okay, for type 2 diabetes, their body can produce insulin, but it is resistant to insulin. That means they do not respond to the insulin. What happens is that people find that obesity is they formally established that obesity is the cause of the insulin. So because they found that for people, they develop type 2 diabetes, if they lose weight, the type 2 diabetes can actually reverse. After they lose weight, their bodies start to respond to insulin. So that's why losing weight helps a lot. The adipose tissue may produce a substance that impair insulin receptor from functioning. And then the insulin level is also low because their cell do not make enough insulin receptor to produce insulin. So diet, exercise, losing weight helps a lot to treat the type 2 diabetes. Diabetic patients, they need to monitor their blood glucose level several times daily. And some of the diabetic patients, they will inject insulin right before they eat. So they monitor the blood glucose level by poking their finger so that they get the blood and then to test with a machine. I heard that some new testing machine, they do not require the patient to poke their finger, which is much better. And also they nowadays they use insulin pump instead of needle, so that it will be easier for the patient to administer insulin into their body. What will be long-term complication for diabetes? It can cause blindness, kidney disease, cardiovascular disorder. It can cause reduced blood flow to the limb, to cause gangrene. Also, it can cause coma in pregnancy. We have something called gestational diabetes. Gestational diabetes because the baby is growing in mother's body, so that the baby requires extra glucose to grow. Glucose, as you know, that you go to the cellular respiration, then you make more ATP, more energy for the body to grow. Because of that, there's something called a glucose-sparing effect in the mother's body during pregnancy to produce more glucose in the body, so that the baby can make use of those extra glucose for body growth. But the extra glucose in the female can cause the gestational diabetes. Gestational diabetes can affect the kid. It can cause something called stillborn or dying after birth. So diabetes is a terrible disease to have. If you have type 1, then there's nothing you can do. But if you have type 2 diabetes, please try to lose weight, and it will help. If your spouse, or you have gestational diabetes, make sure that you go to see your OBGYN. They will. Usually they don't do anything. They will just tell you to monitor your blood glucose level every day. But if it is too severe, then they will suggest some treatment for you. So that's the end of this week's online lecture.